Stick your tongue out. Go find a mirror. Actually look at it. Not a glance. Look. There's a chance you'll see something unexpected, something that doesn't match normal. And once you see it, you can't unsee it. Most people have never studied their own tongue. We obsess over every body signal: heart rate monitors on wrists, sleep trackers on nightstands, glucose sensors under skin. But the tongue, just sitting there, ignored. There's a reason that's a problem. The tongue has been a diagnostic surface for over 2,000 years. Traditional Chinese medicine practitioners were mapping it, drawing anatomical charts, long before anyone had a stethoscope. And I know how that sounds, but this wasn't mysticism. It was pattern recognition, careful clinical observation across generations. Specific tongue changes appeared consistently in patients with specific internal problems, before those problems became obvious, before symptoms fully arrived. The scientist who named the sonic hedgehog protein, yes, that's a real protein in your body, named it after the Sega character. His kid was obsessed with the game. Anyway, the point is, sometimes the most useful discoveries come from people paying attention to things everyone else dismissed. That's exactly what's happening with the tongue right now. Modern researchers are starting to catch up, and what they're finding is uncomfortable for anyone who wrote off tongue diagnosis as pseudoscience. The tongue and the gut are not just connected, they're developmentally connected. Same embryological tissue layer. The mucous membranes lining your digestive tract and the surface of your tongue share the same biological origin. They share vascular pathways. They respond to overlapping immune signals. So when something goes wrong in the gut, inflammation, bacterial imbalance, motility disruption, the tongue doesn't just metaphorically reflect that, it reflects it physiologically. A 2022 study in Cell, Host, and Microbe used metagenomic sequencing to profile bacterial communities on the tongue. And what they found was not random, it was patterned. Specific gut dysbiosis profiles, meaning disrupted gut microbiome compositions, correlated with distinctly different tongue microbiomes. Not slightly different, meaningfully different. Different species, different ratios. So the tongue isn't passive, it's an active node in a network running the entire length of your digestive system. Now, there's a term for this, the oral gut axis. It doesn't get nearly the attention of the gut-brain axis, but in some ways it's more useful immediately because you can observe it directly, no laboratory test required. The coating on your tongue, that whitish layer, is made of shed epithelial cells, bacteria, food debris, in protein-rich fluid. In a healthy digestive system, it's thin, evenly distributed, barely noticeable. That's the baseline most people never see because most people's gut is slightly off most of the time. When digestion is compromised, low stomach acid, sluggish intestinal motility, bacterial overgrowth, that coating changes, it thickens, it can turn yellow, which often tracks with bile reflux or liver stress. In severe cases, gray or brown, which is a brutal thing to discover in a bathroom mirror. Researchers have now documented this with actual imaging data, not just clinical impression. A 2020 study out of Zhejiang University trained a neural network on tongue photographs and gut health assessments simultaneously. The model learned to predict small intestinal bacterial overgrowth, SIBO, from tongue images alone. Not perfectly, but consistently enough to flag it as a screening tool. That's a messy, exciting, underreported finding. Almost nobody outside research communities is talking about it. Then there's geographic tongue, 2 to 3% of the population, probably more. Smooth red patches on the tongue surface where tiny papillae projections have worn away. The patches migrate over weeks like a shifting topographical map. For most of the 20th century, classified as benign, cosmetic. Doctors would note it, shrug, and move on. But it keeps showing up in patients with psoriasis,
with atopic dermatitis, and, here's the weird part, with celiac disease, at array to meta-analysis found statistically significant. The current hypothesis is clear. Geographic tongue is a superficial expression of systemic immune dysregulation. The gut immune response is activated. The mucosal immune network reacts. The tongue reacts with it, which means the tongue might be showing you an immune problem before the gut produces recognizable symptoms. That's a quietly dramatic idea. Cracks are another signal. Fissured tongue, deep lines running down the center or branching across the surface. Traditional diagnostics described this as a sign of patients who couldn't retain fluids, who had poor mucosal integrity, who showed signs of malabsorption. Severely malnourished patients develop tongue fissuring. It's documented in clinical literature. It's not coincidence. It's the body's surface telling you something about the body's interior. I mean, the mechanism makes sense when you stop being precious about the source. But here's where I want to slow down, because this is the part that actually matters. The tongue is noisy. It's affected by hydration levels, by medications, by smoking, by oral hygiene routines, by genetics, by what you ate an hour ago. Someone with a thick yellow coating might have significant gut dysbiosis. They might also just need a glass of water. The signal is real. The noise is also real. Nobody should self-diagnose from a bathroom mirror alone. What researchers are actually building now, and this is where the trajectory gets interesting, is a standardized imaging and modeling system. Controlled lighting environments, machine learning applied to color variation, tongue swabs as a proxy for gut microbiome status. The goal is to turn the tongue from a vague clinical impression into a quantifiable biomarker. And the reason that matters isn't just science, it's access. Most people on Earth don't have routine colonoscopies or comprehensive microbiome panels. Those are expensive, invasive, logistically out of reach for most of the global population. A tongue assessment, visual or swab-based, is cheap, scalable, and if predictive models continue to hold, it could catch gut dysfunction early, before dysbiosis becomes metabolic syndrome, before inflammation becomes systemic, before the quiet problem becomes the loud one. Actually, there's a line of research connecting disrupted gut microbiome composition to early Parkinson's pathology, changes appearing in the enteric nervous system years before any neurological symptoms surface. Years. The gut is involved in far more than digestion, and the cascade usually starts quietly, which is the uncomfortable thing sitting underneath all of this. The body has been running a diagnostic readout this whole time, on a surface you could examine with your phone camera, in a language that used to be legible, that modern medicine stopped reading, not because the information disappeared, but because the framework for interpreting it got left behind. The tongue didn't change. We just stopped looking.